Okay, guys, I'm going to take you on a tour of Shores Veterinary Emergency Center. This is the main entrance. You come in and there's a waiting room. We haven't really used it that much because of COVID, but usually they'll be able to come in and we call them back into the exam room. This is the front desk. Like I said, we really haven't been letting that many people in, and when we do let them in, they come right through the trauma doors and go to the exam rooms. Here's one of the exam rooms. Sometimes we've been bringing the clients in more, just to get them out of their cars as much as possible. But if they don't want to, they can go sit in the cars. Sometimes we have the patients in here with them, depending on how severe it is. But that's that. And there's 3 of the exam rooms on this side. This is the triage room. Basically, like if we have a whole bunch of patients and one's more severe than the other, we'll have them come in here and wait. This is the trauma entrance, and oh, it's raining, great. This is trauma entrance, and basically all those numbers are for the clients to come in and pull in, give us a call, tell us what's going on, what spot they're at, and we'll come out to them. And then this is where everything happens, where all the clipboards go. This is our board. This is the x-ray room. They have anesthesia machine in here. If we need to pull blood and IV catheters, whatever, everything's up there. They have an ultrasound. So I really like their x-ray machine. It's really user-friendly. Everything's digital. This is the nurses station. And this is the lab. This is the lab where all the lab work gets done. We rarely send anything out. Everything we really do in here. But yeah, I really got to learn how to use a couple different machines, and even if it is the same one from school, some of them are set up a little bit different. This is the ICU, and the ICU is right beside the nurse's station, so that we can literally just turn around, boom, everything's right there. This is the pharmacy. All the drugs are here. And that's where the controlled drug log is. Not the controlled drug box. That's where the controlled drug box is. And then there's a mock box right next to it, just in case anybody breaks in or whatever. That's where there's more drugs in there. And then there's a lot more food in there as well for any patients. And there are the clips that we use for the machines, for the counts. Why can't I talk? Here is all the laundry stuff, cleaning stuff. They have litter boxes and litter down here. But yeah, there's nothing really too exciting back here. Well, I mean, there's the freezer where we put all the bodies after euthanasias, or if they pass away. If they want to be cremated, then put them in here and get everything situated in this box. And I think they come pick them up on Mondays and Thursdays. The guy comes gets them. So that's everything over there. Here's just some of the tables. So when we do our TPRs and get everything started, doctors come over here and look at the patients, and depending, like I said, how severe it is, either they go in one of the runs or they can go back in the room with the clients. Hi, buddy. Here's more of the runs, just like over in the ICU, but they have a couple of oxygen tanks, which is really neat. And also, they're all individual, so if two patients are right here and they both need different levels, they're not run together. Like, I can set this on a different setting and I can put that on a different setting. It's all different. So yeah. And they have stuff for, so everything's in here and we don't have to keep running back and forth to get supplies if we need to draw blood, to do any more diagnostic blood work or anything like that. This is our surgery room, and here's anything and everything that has to do with surgery, the autoclave and all the instruments and gowns is in here. We are getting a new team and surgeon, and they start on the 26th. Here's another room that we haven't, well, we're getting set up for them when they come in. And I'm excited for them to come. I'm really excited for them to come because I want to see more. They're here so they can do more difficult surgeries and all that. And I want to see it. And I want to learn how to do it. So, yeah. Trying to think what else is there to show you. This is the isolation. Okay, so I had to stop the video because the dog is trying to pull his catheter out. But besides that, I had to get Micah to go in because they let me in the isolation area, but still, you only want whoever needs to go in. So we kind of keep that as minimal as possible. This is the other side of the wing. They have more exam rooms. This is for special procedures, but we usually use it just for ultrasound. I've been in here like twice. They usually send like transfers over to get ultrasounds. This is the visitor's room, but it's more of like the euthanasia room. It's really quiet and just away from everybody, so they can have as much time as they need. When it's not raining like this, there's a water fountain right there. Back here is really neat. They spend a lot of time on it. If they want to come out here with their animal or just spend time to themselves, as much time as they need, they can just come out here, and it's no rush. I mean, yeah, we just want everyone to feel as comfortable and grieve if they can. So, and then we're back to square one. Oh, there's the bathroom. But yeah, that's Shores Emergency Center.